Welcome everyone. This is the first video discussing our clinical guidelines for several counties here in East Tennessee. I'm going to start with kind of an overview and approach to the clinical guidelines. In subsequent videos, we will break down individual sections as well as individual guidelines in some cases. And as always, any sort of feedback is appreciated either on the educational aspects of the videos or on the guidelines themselves. As far as the guidelines go, they are not broken, as some agencies do, into separate pediatric guidelines, into separate BLS guidelines. They are all merged together for simplicity's sake. They are organized in several categories. This starts out with universal care, or care that you should be using for pretty much any patient encounter. Then Section A, which is airway and breathing. Section C, which is our cardiac guidelines. Section E, which is environmental exposures and toxicology guidelines. Section M is kind of other medical complaints not associated directly with one of the other sections. OB guidelines. P is the psychological or behavioral guidelines. RX is our medication guidelines. T, obviously, trauma guidelines. X are the death guidelines, including DOA guidelines and discontinuation of resuscitation guidelines. Z is kind of our general operations guidelines. And finally, there are attached special event or operations guidelines, which are specific to certain agencies. Within each section, it's broken up into both your general guidelines here on the left, as well as both procedure and reference guidelines. The standard medical guidelines have the leading either number here, as well as a numeric after it. So A-01, C-01, all the way down. Let's see if I can cancel this off. There we go. And then, obviously, as far as procedures go, they will be kept within sections. So again, 1-P1 for IO placement, and then reference guidelines will also be kept at the end as far as 1-R1. Within each section, they will generally be referenced in this manner. In the full PDF, there will be page numbers. However, the reference numbers for each guideline will be in the PDF copy as well. As far as within each section, again, we'll break this down at a later point. But airway and breathing has your general airway maintenance, CHF, COPD. Your airway devices and procedures. Cardiac both starts with the cardiac arrest guidelines, and then your pulsed cardiac dysrhythmia guidelines and chest pain. Environmental toxicology section delves into different chemical exposures, drug ingestions, different sort of environmental exposures like hypothermia. Other medical complaints includes your allergic reactions, your medical shock, which is going to encompass cardiogenic shock, septic shock, neurogenic shock, basically anything besides hemorrhagic and traumatic shock. Also included in medical is stroke and seizures. OB is probably going to be rarely used, and most of these are protocols that are for very specific and very rare presentations of abnormalities in delivery. Psychological behavioral includes physical restraint, The medication specifically, there's a separate medication guideline for both pain management as well as another one for chemical sedation. Trauma is divided initially into your multi-system kind of traumatic arrest, hemorrhagic shock guidelines, and then into more localized trauma. And then finally, the general operations includes things such as determining patient or no patient, determination of capacity of the patient to make their medical decisions, and then refusal of care guidelines, amongst others. So again, in the future, we'll kind of delve into the individual aspects of that a little bit. As far as the protocols themselves go, and again, we'll get into specifics, but as far as the overview goes, and this is taken off the medical shock protocol, on the top left, you're going to have your both alphanumeric reference number to the guideline as well as its title. These are repeated at the bottom as well with the title as well as your alphanumeric. If it's in PDF format, you're going to likely have a page number down here in the bottom below the title as well. In the top right, there is a color-coded provider key. Now this is kept fairly standardized throughout the document as far as the basic educational and licensure requirements for certain levels of care. And as you can see, kind of the light blue with first responders, your EMT is green, your advanced EMT is yellow, and orange denotes paramedic level skills. And you can see those. This is set up a couple different ways. One is in these boxes where you'll have both the color as well as the kind of the alpha code for each level: FR first responder, A for advanced, P for paramedic, etc. It may also show up as in just a reference or cross-reference to another guideline, like this one, light blue, would denote basically medical first responders and above can reference or should reference that document. And the flow is generally going to start from our universal care guidelines and work its way down. Now, these are meant to be guidelines. They're not meant to be line item protocols. You may end up using one of these guidelines, none of these guidelines, or multiple guidelines on a patient, just depending on their presentation. The other thing, if you can notice in the center, there is a medication, kind of how we have the medication administration set up. And here's kind of a little blown up version of it. And again, this shows you both the minimal provider level to utilize this medication, the obviously name and the adult dosing of your medication. Pediatric dosing is generally identified with the pink, as well as the PEDS weight-based dosing if it's applicable. And then kind of more specific notes within that specific guideline are included as well. So again, these are just meant to be overviews of the guidelines. We will go on to individual sections and individual guidelines in the future. If there's any questions, any concerns, any suggestions, please feel free to contact me at East Tennessee, eastTNEMS@gmail.com, or another manner as well. But thank you all for your time, and good luck out there.